Welcome to Just in Time, a podcast series provided by the Washington State Department of Social and Health Services, Developmental Disabilities Administration. I'm Kenny Davis.
And I'm Robin Wiseman. We will be your hosts for this fun, interactive, and informative podcast specially created for residential providers working to support and transform the lives of people with developmental disabilities across the state of Washington.
Each episode aims to educate through conversation, highlighting DDA's guiding values of inclusion, status and contribution, relationships, power and choice, health and safety, and competence. With that, enjoy the show.
As you know, Kenny and I work to support residential providers in the state of Washington. And our providers face many challenges in the good work they do every day, including hiring quality staff members and keeping them, providing high quality and individualized support to people with disabilities, and adhering to agency and state policies and mandates, and keeping the people they support and staff safe and healthy. Can you review the 9 tenets of NADSP's Code of Ethics and discuss them with these provider challenges in mind?
Sure. I can actually, it's probably best for me to describe them in the framework of a direct support professional. That's kind of where we're coming from. So there are 9 tenets, 9 pieces of the Code of Ethics, and each of them has a general statement, but they're a lot more in depth. So when you look at the 9 tenets with each statement, there's bullet areas attached to them that provides direct support professionals with a lot more information. So the first tenet, and this is the big one. If there is if you think of the Hippocratic Oath in terms of "I shall do no harm," then I think you can look at the Code of Ethics for direct support professionals in terms of person-centered supports. And the first statement reads like this: "As a direct support professional, my first allegiance is to the person I support. All other activities and functions I perform flow from this allegiance." Well, that's a doozy, right? I mean, that is loaded with a lot of questions. My first allegiance is to the person that I support. Well, what about my supervisor? What about the state regulations? What about the people that I support's families and guardians? Do they count? Of course they count, right? They count, but my first allegiance is to the person that I support. And that is tricky. So, for example, I'll give you a great example from my own history of supporting people is, I was supporting somebody and they wanted to get a tattoo. And that was very person-centered. The person wanted a tattoo. And so do I just say, sure, let's go, I'm person-centered. I'm a person-centered direct support professional. Let's go get that tattoo. Well, what I didn't know is, what did the person know and understand about tattoos? Did they know that they are permanent? Did they know that you can't easily change them once they're on? Did they know that it was expensive? So providing the person with a whole lot of information is probably more person-centered than just saying, yes, let's go get the tattoo, right? Or on the other hand, a lot of direct support professionals would say, well, I don't think a tattoo is for you. I don't think you should be getting a tattoo because it's really expensive or because it costs or it's permanent. This is something that really requires a whole lot of work on behalf of a direct support professional. Being person-centered is just not doing things that the people want to do. It's helping them make good, sound decisions for themselves. And when they make that decision, it's their decision. It's not our decision. So recognizing that each person that we support is capable of directing their own life and helping people advocate for the things that they want when the system or guardianship or guardians are preventing them from doing the things that they want. So being person-centered is, everybody says they're person-centered, but do you really understand how difficult it is for a direct support professional to be person-centered? So that's the first tenet, and that's the big one, right? The rest all kind of fall in line. The second one is promoting physical and emotional well-being. As a direct support professional, I will commit to promote the emotional, physical, and personal well-being of the people I support. I will encourage growth and recognize the autonomy of those receiving support while being attentive and energetic in reducing the risk of harm. Attentive and energetic in reducing the risk of harm. So promoting physical and emotional well-being is something that most direct support professionals have been really involved in the last 2.5 years. And when you take a look at this one, promoting physical and emotional well-being, and we do some trainings on the Code of Ethics, and we use role plays. And a very common role play that we use in supporting people with disabilities, a lot of direct support professionals are supporting people who have some sort of restrictions in their plan, whether it be a dietary restriction or some sort of restriction that is part of the plan that is approved by the team. A very common restriction is coffee intake. And I would bet that there's direct support professionals listening right now who are dealing and working on some sort of dietary restrictions. And so a coffee restriction is pretty common. I supported people who had coffee restrictions. And it's hard to, prevent somebody who loves coffee. It's hard to prevent them from getting coffee. So if you're supporting somebody, do you and they're drinking coffee, do you take it out of their hand? There's cases in many states in this country where people are physically restrained over these restrictions, and a direct support professional is really stuck right in the middle. And if you're supporting me, I love coffee. You try to take the coffee out of my hand, you're going to be wearing coffee, and you don't want, you want to avoid these types of things. So again, the direct support professional, you need to be attentive and energetic in reducing the risk of harm, but you cannot control another person, whether they have a disability or not. If they want coffee, they're going to get coffee, but we need to be attentive and energetic in reducing their risk of harm. And most people have these restrictions because it could be harmful to people. Special diets, coffee intake, cigarettes, smoking, cessation, and all of that stuff. So DSPs really have to walk a very careful line when it comes to promoting emotional and physical well-being. It's a big part of the work that we have, And direct support professionals, I want to say this, Robin, direct support professionals have to follow the plan. You have to follow a plan. However, if a person is struggling with that plan, then it is your responsibility to work with that person to get the plan changed. And that's another piece of the Code of Ethics that I'll describe momentarily. The next area is integrity and responsibility. If we want to be seen as professionals, then we need to act and behave as professionals with integrity and with responsibility. And it reads like this: as a direct support professional, I will support the mission and vitality of my profession to assist people in leading self-directed lives and to foster a spirit of partnership with the people I support, other professionals, and the community. So we have an ethical obligation to be responsible and act with integrity. I have to be aware of my own values and how they may influence my professional decisions. I have to maintain a high level of competency in the skills that are required to be an effective direct support professional. I have to be responsible and accountable for my decisions and my actions. when there's meetings, I need to be on time. I need to communicate clearly with my colleagues. I need to be responsible in my work habits. Direct support professionals who I know, and I know a lot of them, they desperately want to be seen as a professional. Well, it requires some work on our part as well. We have to act and behave and be professional to be seen as professionals. We've for decades, Robin, direct support professionals have been seen as paraprofessional or companions or aides to people with disabilities. And my belief is this is such complex work that we are not companions or just direct care providers. We support people in every aspects of their lives, whether it be at home, at work, in their communities, with their families. We have to be professional. So that's a big piece of it, right? And you see where we're going. So we're trying to cover all the bases here that a direct support professional, potential conflicts, potential barriers or dilemmas that come in our way. The next one's confidentiality, which is a pretty basic one. I think DSPs, across the state of Washington understand our responsibility to maintain and safeguard confidential information. I mean, HIPAA, right? I mean, we all have HIPAA training. But what we're talking about, we will safeguard and respect the confidentiality and privacy of the people that we support. And we will seek information directly from those that we support regarding their wishes in how and when and with whom information is shared. And we need to recognize that confidentiality agreements are subject to laws and major laws in our country and regulations at the federal and state levels and within agency policy. We have to understand that. There are times, of course, where we have to break confidentiality when the health and safety of people are at imminent risk. And we need to understand that if it's unclear to us, that we seek out guidance to help clarify any situations where the correct course of action is unclear to us. So maintaining privacy and confidentiality, I would argue that every healthcare professional needs to be aware of, but direct support professionals more precisely, because we are enmeshed in people's lives and working really at deep levels in people's lives where those professional boundaries are often mixed and complex. So confidentiality is a big piece of it. The next piece, justice, fairness, and equity. Helping people. As a direct support professional, I affirm the human rights as well as the civil rights and responsibilities of the people I support. And I will promote and practice justice, fairness, and equity for the people I support and the community as a whole. This is a tricky one because we see DSPs often, and people with disabilities are still discriminated against in many communities. And DSPs need to understand when we go out to dinner or we go to restaurants, we don't need to sit at the table in the back of the restaurant away from everybody else. That's injustice, right? So we have to assist the people that we support to access opportunities and resources of the community that are available to everybody. And we need to make sure that the people that we support understand their own rights and their own responsibilities. And lastly, we also need to understand, guardianship is a big issue, and every state has different guardianship laws, the limits of guardianship and the powers of guardianship. And I think anecdotally, I can tell you, Robin, that a lot of direct support professionals just automatically defer to a guardian. And that is not necessarily the case. So I think direct support professionals really do need to understand what guardians are able to do. So that's a big piece as well. And that brings the work that really illustrates that this work is not just caregiving. It's about justice, fairness, and equity. The next piece, we talk about respect. And respect is, as a direct support professional, respect is respecting the human dignity and uniqueness of the people that we support. As a direct support professional, I will recognize each person as valuable and promote their value to our communities. We have the honor to support people who have unique interests, unique desires, unique support requirements. Everybody is different. And I can reflect on some of the people that I supported who were just such interesting people. But in the community, some people may not value that. So we need to understand the people that we support in the context of their personal history, their social and family networks, their hopes, and their dreams for the future. And we should not be judging people for who they are and what they like. And for a great example is, I would really encourage your listeners to kind of deconstruct the code of ethics. A great example is, the clothes that people wear, clothes that people with disabilities may wear, or coloring. Should adults be using coloring books? Well, what's the difference, right? I mean, if we really respect the people as valuable and as unique individuals, then let them be who they are, right? And promoting their uniqueness to others. It's a big part of our work. So respect is a big piece of it, and not judging people for who they are and what they're doing with their lives, and really promoting in a very person-centered way that respects people for who they are. Relationships is the next tenet. As a direct support professional, I will assist the people to develop and maintain relationships. The data is pretty clear, Robin. Many people with intellectual disabilities are lonely. Many of them don't have a lot of friends. And some direct support professionals, again, with the best of intentions, may say, well, I'm your friend. I will be your friend. And that's not who we are or what we do. Our job is not necessarily to be your friend. Our job is to help you make friends and understand what relationships are. What is the most important thing about a relationship and friendships is reciprocity. Do the people that we support understand that friendships are a two-way street? You give and you take. You give and you take. And that's a really important skill for people with disabilities to understand. So we will advocate with the people that we support to have opportunities to build and maintain their own relationships. I'll tell you another real clear dilemma for direct support professionals is when the people we support form friendships and relationships with people that we don't approve of, that we think are sketchy, quote unquote, or dangerous relationships. And we have to refrain from expressing negative views or judgments or on those friendships. We have to make sure that people, again, through a discovery process, making sure that people understand what friendships and relationships are. And I got to be honest, people with disabilities in communities are easily exploited and taken advantage of by others in the community. And that's a tricky thing for DSPs to navigate, right? So relationships and helping people understand the relationships and another thing is, and for DSPs who sometimes through our work and the relationships that we build with the people, it's easy to be judgmental of families. And I've heard many DSPs, be highly judgmental of families and their lack of involvement in people's lives. And we can't judge families. We need to work with families, and everybody's stake is different here. And so it's easy to be unethical around relationships for a DSP. Next, we go to self-determination, and this is a good one. As a direct support professional, I will assist the people I support to direct the course of their own lives. Nothing is there's nothing that we do that is more important than helping people direct the course of their own lives. And we need to make sure that we support the rights of people with disabilities to lead self-directed lives and to work in partnership with other members of that person's support network to make sure that this person is leading the life that they want to lead by promoting self-determination in physical, intellectual, emotional, social, and spiritual pursuits. That's a big part of our work. And we have to honor that person's right to assume risk in a very informed way. And I do believe that one of the most important things that we can do for direct support professionals is how to help people with risky decisions. It's not black or white. It's a very gray area. So helping people direct the course of their own lives is a very, very important thing that we do. And lastly, which a lot of direct support professionals misunderstand, is advocacy. And there's one really important word in this first line. As a direct support professional, I will advocate with the people I support for justice, inclusion, and full community participation. And that one word, with the people. We do not advocate for people. Everybody, regardless of their disability, can advocate for themselves. We need to make sure that we work with people and the people that love them and know them best to advocate together. We need to support people to speak for themselves and help people find their voices and promote those human and legal and civil rights and seek guidance if we are unsure of some of those actions around advocacy. I don't think that DSPs should be advocating on their own, because it's very easy to infuse your own values. We need to help people advocate for themselves. So you can see where the code of ethics, there's no answers. It is a roadmap to help DSPs navigate a really complicated job.
Absolutely. And very challenging. And you outline a lot of challenges that, are difficult for anybody, let alone deal in a relationship with people with disabilities in a role of support. Um, those challenges are almost magnified. I really appreciate the code of ethics, your code of ethics, and think there's a lot for us to think about, right?
Yeah, there really is, Rob. And you know something, there's organizations around the country and a couple of states who have formally adopted the NADSP's code of ethics, to which, of course, we thank them. But the code of ethics can't be something where you just kind of read it and sign it and saying, I will be ethical, right? It needs to be incorporated into daily practice. It needs to be part of your everyday job. And when you're finding yourself struggling in some area, it's handy to go to your code of ethics and see what it says. It guides you.
I think revisiting it on a fairly regular basis, because it's so much. There's a deep understanding that require us to continue to look at the code of ethics as a guideline for our day-to-day work.
Absolutely.
So yeah, no, that's incredibly helpful, Joe. I really appreciate that, and your time. How can our providers and their direct support professionals get involved with NADSP?
In a variety of ways. First of all, the Code of Ethics, you can download it off of our website, and we have posters and we have wallet cards and we have brochures, and we want you to use the Code of Ethics. There's no charge for using the Code of Ethics. And I think that's a big piece of it. But furthermore, we also, and I'm not selling anything, but I want to call your attention to, we actually have a curriculum, a train the trainer curriculum on how organizations can teach the Code of Ethics to your direct support professionals and others, and how to infuse it in their everyday work, to make sure that DSPs have access and the resources to be ethical. And furthermore, there's a whole lot of information on our website about NADSP and our career ladder programs, our credentialing programs, our advocacy work. If you're a member, you have access to a whole online archive of webinars and recordings. So, I mean, understanding that the NADSP's sole mission is to promote and advocate for developing knowledge, skills, and values in our direct support professionals, and making sure that they get really good, sound information about your work. My biggest concern about the work that we do is a lot of direct support professionals don't understand the role that they play in this service system. They are more than essential workers. They've always been essential workers, but they are critical in a person's life. And DSPs need to know that without them, the system would fail to function. And they need to be more engaged in public policy. I think DSPs need to be more involved in advocacy work on their own behalf. And we can help you do that. So, just go to nadsp.org and browse our website. There's a lot of great information on it.
Yeah, absolutely. And I really appreciate your partnerships across the country, and in an effort to work with everybody where they are. And I'm glad that we are in touch with each other, and that hopefully we'll be working together for some time to come.
Oh, I hope so too, Robin. Thank you so much.
Yeah, Joe, I really appreciate all of your time and your feedback and your great insight. Thanks for being with us, and I hope you be willing to come back again sometime.
Absolutely. It was my pleasure, and anytime I'm happy to talk to you folks.
All right. You're great. Thanks, Joe.
Thank you so much, Robin. Thank you, Kenny.